Immune reconstitution inflammatory syndrome. It is seen in AIDS patients who are undergoing antiretroviral therapy. So the two main goals of antiretroviral therapy is to decrease this viral load and increase the CD4 count. So what happens when the patient is taking this antiretroviral therapy? There will be sudden rise in CD4 count. It can cause inflammation. So that is called as immune reconstitution inflammatory syndrome. Right? So what is happening here? The patient will be having some occult opportunistic infection. That means the infection is there in his body, but it is not showing clinically. So in that case, the sudden rise of CD4 cells will be acting on those occult opportunistic infections and cause inflammatory reaction, right? Or in some cases, there can be dead pathogens which are still not removed by this body. So in that cases, again, this sudden rise in CD4 cells will be acting on those dead pathogens and create an inflammatory reaction. So this presents as a clinically worsening of a treated opportunistic infection, and atypical presentation can be seen. So why is there clinical worsening of a treated opportunistic infection? Because the opportunistic infection is already treated, but the dead pathogens are not removed. So this new CD4 cells will be acting on those dead pathogens, which will be causing clinical worsening of the treated opportunistic infection, right? So the patient will be often protracted, and it can also lead to the fatal conditions. So this IRIS, which is immune reconstitution inflammatory syndrome, can be because of underlying opportunistic infections. Again, it is because of the inflammatory unmasking of opportunistic infection. What is the meaning of this line? There is some occult opportunistic infections present in the body which will be unmasking because of the effect of increased CD4 cells, right? Normally, if there is low CD4 cells and there is occult opportunistic infection, there will be no rise of these symptoms because there are not much cells enough to fight against these infections, right? But in this case, because of the increasing CD4 count, it will fight against these occult infections and it will cause inflammatory unmasking of opportunistic infections. So it can also present as paradoxical clinical deterioration of opportunistic infection that is already treated. And the other thing is autoimmune diseases. For example, in the Graves disease also you can see this IRIS, and also in the malignancies like worsening of Kaposi sarcoma. So in all these cases, you can see immune reconstitution inflammatory syndrome, in whom the CD4 count is less than 50 cells, and the sudden drop in HIV RNA levels after initiation of heart therapy, opportunistic occult infections, or the ongoing infection. So these are the predisposing conditions for this IRIS. So these conditions are susceptible to IRIS. Only 30% of patients develop it. Coming to the management, you have to continue this antiretroviral therapy, but if there is any severe life-threatening condition, you can discontinue it. And also for the pain, you can use NSAIDs and corticosteroids to reduce the inflammation. And if there is any Kaposi sarcoma or any worsening of any malignancies, you can treat the malignancy first. So this is about immune reconstitution inflammatory syndrome.